Hi, Miss Martin. My name is Kimberly Dawes, and I'm here today to do my IV push and my IV piggy competency. The first thing that we're going to do is we're going to check our physician orders against the MAR, comparing. We have an order for gentamicin 60 milligram every 12 hours, IV piggyback, and we have an order for furosemide 30 milligrams IV push every 6 hours. So we checked our orders. We're going to make sure that we have the right patient by checking the chart. We're going to check the MAR. We're going to also check the patient's identity when we get in the room. We're going to make sure that we have the right type of medication. And right here I have furosemide, so we know that this is the right medication. I'm going to talk about both of them at the same time. And this is our gentamicin. We have a 100 milliliter bag, and this is our gentamicin. We already have the label on it. So we have the right medication. We're going to make sure we're giving the right dose. We know that we are giving the right dose because we already did our calculation prior. We're going to make sure that we give them by the right route. Our furosemide is going to be IV push. Our gentamicin is going to be IV piggyback, and we're going to give it at the right time. Now we're going to check our patient's chart for any allergies. Our patient does not have any non-drug allergies. And then we're going to check our medication against the MAR. Okay, and everything matches up. So now what we're going to do is we're going to check for compatibility to make sure that the furosemide, and we're going to make sure that the gentamicin is compatible with our primary fluid. And we have 5% dextrose, and the furosemide and the gentamicin is compatible with our primary fluids. So now we're going to check any pertinent lab. We're going to check electrolytes for both of them. We're going to check blood pressures. We're going to check renal function. And we're going to teach our patient. We're going to teach our patient to call us when they get ready to get up. They need some assistance because the furosemide can cause hypotension. We're going to make sure we monitor with the gentamicin. We're going to monitor bun and serum creatinine levels. And we already checked compatibility. We looked at our pertinent lab information. So now we're going to make sure that the medication is a safe dose. And we do know it's a safe dose because we already calculated our dosage prior to administering our medication. Our furosemide does not have to be diluted. We can give it undiluted. And we can mix our gentamicin with 50 to 200 milliliters of any compatible diluent. We're going to give this at a rate 40 milligrams or a fraction thereof at a rate over 1 to 2 minutes. And I already said the rate we're going to get this over 60 minutes. Now I'm going to wash my hands, and I'm going to gather my equipment for my IV push and my IV piggyback at this time. So, washing the hands. For the IV push, we're going to gather a syringe. I'm giving 3 milliliters, so I'm going to gather a 3 milliliter syringe. I'm going to gather my furosemide, my alcohol swabs, and for my gentamicin, I will gather my gentamicin. It's labeled. I'm going to check the expiration date. It expires September 2020. I'm going to check for any particles, any cracks. I'm going to also check my tubing. I'm going to label. I'm going to have the name of the medication. I'm going to have my date and time. And I'm going to have my drop factor on here, my drops per minute, and my milliliters per hour on here. And I'm going to also get my tubing, and it has 15 drops per minute, but we're going to pretend that it has the 10 drops according to my order per minute on here. So since my hands are washed, and we're going to get some gloves, we're going to inject 3 milliliters of air in, and we're going to draw up our furosemide. Okay, discard. And now we're gonna draw up our 3 milliliters. Okay. All right. 3 milliliters. All right. This is 3 milliliters, and this is furosemide. At this time, we're gonna also, we would have went on, we could have primed our tubing in the room, or we could prime our tubing at the bedside, because this is my second time, my tubing is already primed. But we're gonna gather all our equipment, gloves, alcohol, our furosemide. We're gonna make sure we put a label on our syringe also, with furosemide on it, 3 milliliters on here. And like I stated, this is already labeled. Now we're gonna proceed to go to our patient's room. Knock, knock. Hi, my name is Nurse Dawes, and I'm here today to administer some Lasix IV Push and gentamicin. Could you verify your identity for me by telling me your name and date of birth? Okay, great, Mr. White. Do you have any allergies? Okay. I'm gonna check your armband just to verify your identity. Okay. Now what I'm gonna do is I'm gonna check the patency of your INT, and I'm just gonna simply lower your primary fluids to the level of your arm. I'll be looking for any blood return just to make sure that your INT is open and patent. And we did have some blood return because we already have these primary fluids infusing. Now I'm gonna wash my hands. I'm gonna put some more gloves on, and I'm gonna just palpate around your site. Okay. You have no redness, warmth, or tenderness, and if you feel any discomfort, let me know. So I want to tell you a little bit about your Lasix. It's going to remove any edema from your body, and some precautions, it can make you a little dizzy. So when you're trying to get up, I need you to hit your call light because you may need some assistance because it can cause orthostatic hypotension. That's the purpose of me checking your blood pressure prior to giving you this medication. And when you're attempting to get up, even if you're not dizzy, just sit on the side of the bed and let your feet dangle a little bit. And I'm going to also monitor to make sure that you are diuresing the way you're supposed to when I administer this medicine. For the gentamicin, I'm going to check to make sure that you are not retaining any urine with this gentamicin. And we'll check your blood pressure and monitor that also. So now we're going to get ready to clean the port closest to you. We don't have to flush because the fluids are compatible. So we're going to clean the port closest for 30 to 60 seconds. I'm going to remove this. And I'm going to attach. We're going to pinch the tubing. The tubing is pinched. We're going to say that we would administer this over 1 to 2 minutes. We're going to verbalize 1 to 2 minutes. Okay, so now we're going to unpinch. We'll discard our syringe. We'll be monitoring our patient for any signs and symptoms of adverse reactions when giving it. We're going to make sure that our patient asks our patient how do they tolerate it. We'll sign, we'll document. Now we're going to get ready to proceed with our IV Piggy Back. We're going to lower our primary fluids. Okay. And we're going to make sure that this is clamped off. And I'm gonna hang this up here. Okay. Find some alcohol. And I'm gonna clean the port closest to the primary IV bag. And we're gonna clean it for 30 to 60 seconds. We're gonna attach. And now we're gonna open up our secondary tubing. And we're gonna regulate it with our primary. We have 17 drops per minute. Too slow. A little bit too fast. Let me count one more time. One more time. Tape. This got to be the one. 1 minute too slow, 1 minute too fast. And I'm barely touching the dial. I think it's the tubing because it ain't the right drop factor. I'm gonna try it one more time. And you can tell it's going too fast. My other's too slow. Almost. Damn it. I will give up. I done lost count. Let me wait till I get on the 12. Okay. All right. Those my 17 drops per minute. We can start counting now. Hold on. Is it zoomed in? On the drop factor. You gotta zoom it in. We're gonna count for 30 seconds. As close as I can get it with the secondary set being at 15. And this should be at 10. So we're gonna start now. Hold on. Now. We can stop that. Okay, so now we got our drop vector. Our infusion is complete, so now we're gonna close it off, clamp up our secondary tubing. We're gonna get ready to disconnect our piggyback secondary set. Okay, we're gonna disconnect. We're gonna take our primary and we're gonna raise it back up, and we're gonna adjust our primary flow rate back to the previous MD order. We're gonna readjust the flow rate back to the previous MD order. We're gonna regulate it. We're gonna put it on a pump at 100 milliliters per hour. We're gonna make sure that we document our IV piggyback and our IV push. We're gonna make sure that our patient had no adverse reactions, and we're gonna make sure we administer everything according to the right dose, the right route, the right time, the right medication, and the right patient. We're gonna use our 5 rights. And this concludes the video. Our primary dripping is on the pump, and this concludes the video.